Hi, my name is Anushka. Right now, I'm at the Biomedical Engineering Laboratory at Stony Brook Hospital. Today, I want to talk to you about the heart diseases, which are the leading cause of death in the US, and how to improve medical treatments for all patients. This is a life-size heart. As you know, it has 4 chambers and several arteries pumping in and out of the body. But a major artery of the heart is the aorta, which pumps fresh oxygenated blood to the rest of the body. But let me show you more about the aorta. If we take a look inside the aorta, you can see the aortic valve, which acts as a gate that pumps fresh blood to the rest of the body. But let me show you more about the aortic valve.
Here's a cross-sectional view of a healthy aortic valve. On the left is the valve open, and on the right is the valve closed. But let's see what a diseased valve looks like. You can see that on the left the valve isn't fully open, and on the right it isn't fully closed. This is due to when calcium deposits itself on the valve and hardens, as seen here and here. This allows the valve to malfunction and impedes blood flow. This is a disease known as aortic valve stenosis.
Let me show you some promising options to treat aortic stenosis and access those hard-to-reach places.
Here's a cross-sectional view of the heart. You can see the right and left atrium and the right and left ventricle. You can also see the aorta and aortic valve. To treat aortic stenosis, there is the option of surgery, where the diseased valve gets cut out and replaced with a new one. But there's also a minimally invasive treatment that can be performed. A catheter that's inserted through the groin goes into the aorta and aortic valve and crushes the old valve, replacing it with the new one. This procedure is called TAVR, or transcatheter aortic valve replacement. You can see the catheter going through the groin to the aorta, and how a new bioprosthetic valve is being put into place. However, TAVR carries a big risk. After TAVR, thrombosis or clotting can occur. This is when a network of blood cells turns into clots and sticks itself on the TAVR valve. This again impedes blood flow and leads to restenosis.
Now, to study this problem, we can't experiment on patients. Instead, people like me are performing research in laboratories and using heart simulators such as this.
Here's the 3D heart simulator that my team designed and worked with. We designed the simulator to mimic the functions of the heart to reproduce clotting post-TAVR. You can see the simulator consisting of a ventricle, the aorta leading to it, and a designed TAVR valve, which are all the main sections of the heart involved in the TAVR valve process. We simulated all the required functions to study where and how clots are formed.
The type of research I perform is vital in order to improve the safety of non-invasive procedures and allow many patients to benefit from it. My research has just ended, so watch out for my paper in the Journal of Cardiovascular Engineering and Technology.